This segment is sponsored in part by UnitedHealthcare.
The last 2 years have been challenging when it comes to our health. And for seniors here in New York, there are some surprising findings when it comes to their well-being. The United Health Foundation recently issued its America's Health Rankings 2022 Senior Report. This report provides a comprehensive look at the health and well-being of older Americans over the past decade. Joining us now is Dr. Rhonda Randall, Executive Vice President and Chief Medical Officer of UnitedHealthcare's Employer and Individual Business. Good to see you.
Thank you for having me.
Dr. Randall, for those who don't know about this report, what is it and why is it important?
Well, as you mentioned, this is the America's Health Rankings Senior Report. It's published by the United Health Foundation. This is the 10th edition of this report. This report in particular focuses on the health of generally those over the age of 65. It contains 62 different measures of our health from 21 different public health data sources.
What are the health strengths of New York when it comes to our seniors?
Well, all states have their strengths and have their challenges, and New York is no exception. One of the most notable is New York ranks very high for seniors who are getting great fruit and vegetable consumption in their diet. You're ranked number 4 in the nation for that measure. That's a good behavior, something we want to see. Also, number 1 in the nation for the number of home health care workers per capita. That's another great measure for the state of New York. You're ranked number 2 for having a low prevalence of obesity among seniors. Also for having a low prevalence of smoking among seniors. So some really nice behaviors for the state of New York.
Conversely, what are the health weaknesses in New York, or what are the areas where we can improve upon?
So the biggest challenges that I see in looking at the measures in this report for the state of New York, poverty is the low rank for New York. You're ranked 47th, and that is one of the things that is pulling the ranking down for the state of New York. Also 48th in the nation for a low prevalence of pneumonia vaccines, a high risk of social isolation. So this is the risk of not having meaningful social connections that has a strong tie to our overall health as we age. New York is ranked 46th in the nation for that measure, and 43rd in the nation for seniors who are not getting enough sleep.
How about nationally? What are some of the key national findings in the report?
The first one is really sobering, a significant increase in the mortality rate. Early deaths increased 17% in our nation from the prior measurement period, but that went higher in New York. In New York, it increased 33%, an early death rate. Those are years lost before the age of 75. So something that we're really paying attention to. Of course, we know that a significant amount of that was due to the pandemic, but other contributing factors are high rates of drug overdoses, drug deaths, and suicides.
Why were seniors ages 65 to 74 the group most impacted by the increased rate of drug deaths?
There are strong correlations between drug use that may have started prior to senior years and continued with you, may also be new. We also see strong correlations between poor mental health. We also see those who have more chronic medical conditions are also more susceptible to drug overdoses.
What do you think the biggest takeaway from the report is?
I think the biggest takeaway is the state of New York prior to the pandemic was ranked 16th overall in our nation among the 50 states for senior health. In this year's report, New York is ranked number 32, and the significant drop was predominantly driven by the increase in premature death.
Well, thank you so much, Dr. Randall. And if you would like further information on this report, head to americashealthrankings.org.